Now, though our numbers are receding, we've seen this before. We've all been through this before. Though many of us want to be done with the pandemic is likely not done with us. However, on a positive note, we are in a different place now than we've been in the past. And much of that is due to the availability of the vaccine and the booster. Vaccination is our path forward out of the pandemic. And as we learn more about the promising effects of the vaccine against this virus, we see more and more that the COVID vaccine should really be considered 3-dose vaccines. That third dose, or what's commonly referred to as a booster dose, really strengthens the protection that comes from the vaccine. A recent study reviewing data from a network of 10 states over 6 months looked at the effectiveness of the vaccine and booster in preventing urgent care and emergency department visits for COVID, as well as preventing hospitalizations. Now, while the 2-dose vaccine provided substantial protection against these medical needs, that protection declined in those who were over 6 months out from that second dose. When they were given a third dose or a booster dose, however, that effectiveness in preventing medical needs for COVID rose back up to about 90%. And that was for both Delta and more recently for Omicron as well. So the booster is critical. And when we look specifically at our medically vulnerable age group, those 65 and older, those who are unvaccinated are 51 times more likely to get hospitalized with COVID than those who are boosted, 51 times more likely.